Okay, we will get started. Well, thank you everybody, and those of you watching at home as well. So just a quick little housekeeping. If anybody walks in late, we'll be sure they get their name in the drawing just the same. We have bathrooms back there. If you need a water, please just raise your hand or walk back to the counter there and grab one for yourself. Welcome to Inside Health. I am Dr. David Kolowski, and we are honored to have a special guest here tonight, Joy Driscoll, dental hygienist who's been in practice now for 30 years, or 31 years we discussed. And it just seems like yesterday, right?
Yeah.
And so she's got a wide-ranging background. Leah will get a little more into that as she does her main introduction. But I wanted to talk a little more about the connection between why would a chiropractic and nutrition clinic have a dental hygienist come in to be a speaker. If you saw my Facebook Live video last Monday, I talked a bit about that. I talked about how way back in the 1930s, a guy named Weston A. Price, he traveled around the world cataloging all kinds of nutritional issues that were seen most clearly in the teeth and gums, and how facial structures were changed when people started eating more westernized and processed foods. And he saw this massive degradation of health occurring right before his eyes in these cultures that were slowly transitioning from that, primitive or what do they call it? Traditional. Thank you. Traditional way of eating to more of a westernized convenience way of eating, and with all the extra sugars and fake oils and all these other things. So this book is dense. It's 500 pages, but it's a treasure trove of information if you want to dig into that. Well, at the same time, back in the 1920s and 30s, a guy named Royal Lee, another dentist, was coming onto the scenes. This guy was a genius by all respects. He was so smart, so far ahead of his class when he was in high school, that his teacher was like, fine, I give up, you teach the class. Literally, he taught his own high school class. And then he went on and he developed many inventions and patents and all kinds of processes. This guy was amazing. And his mother was very sick back in the mid-1920s. And so he started putting that together and started trying to figure out, like, what's going on with my mom? I gotta save her. And so he developed, in 1929, Catalin, the very first nutritional multivitamin, made out of whole foods. Everything was straight from the ground to the pill. It came out of the earth and nothing synthetic, nothing extra. He just trusted that nature had the solution. And sure enough, his mom got better. And he kept on refining and developing and turned that idea into many more supplements. And eventually now we have a whole shelf full of countless supplements, and it goes on and on. Well, Royal Lee, being the genius that he was, he wanted to figure out, how do I assess the body to figure out what's going on, or if they even have these nutritional deficiencies. And he thought that the best way to look at the body to see this, he knew, of course, with dentistry, like the mouth is a glimpse of what's going on deeper inside your body. You can look inside the mouth and get an idea of what's going on in the bones in general, what's going on in the intestinal lining. Your gums and your inside your mouth is almost a perfect representation of what's going on in the rest of your body. But he thought deeper. He wanted to look a little deeper. And so he's like, well, what can I learn from the heart? I can measure the heart really easily, but can I see what nutritional deficiencies and issues are going on with the heart? Well, so he developed a machine that he called the Heart Sound Recorder. And this device wasn't really a microphone, it was more of a seismometer. It would pick up like the action, the vibrational frequency, thank you. Like if seismometer picks up from the earth, this is picking up the vibrational frequency from your heart and being able to see the physical function of the heart on these graphs. And what he was able to see was if somebody had a heart that's out of rhythm or out of balance, then he could give that person a B vitamin or a C vitamin or a fatty acid supplement or something like that, and have them chew it up and take their test again right there in the moment and see a physical change in the function of the heart. So he's like, whoa, this is pretty cool. So they developed this whole thing, and years went by, and that device was basically lost. there were still a few around, but they were old. They were built in the 1930s and 40s, and they were falling apart, and nobody could figure out how they worked because Royal Lee was such a genius, nobody could reverse engineer the thing. It took literally until about 5 years ago for this technology to be effectively assessed and reverse engineered and turned back into an effective heart sound recorder. That's what we have right here. So we can see the function of your heart and correlate that with nutritional deficiencies, and that's pretty cool. I know many of you in here have actually done this. All right, so getting back to this whole idea of nutrition and how all this wraps together with dentistry. Well, Royal Lee was a dentist. The heart sound recording was his invention. And another chiropractor named Dr. George Goodhart, he was also this outside-of-the-box thinker. And he was like, okay, well, if the heart is a muscle and it can show us all these nutritional details about how things are functioning in the body, can we use another muscle? Can I press on an arm or press on a leg and get, to try to get that same response and see how it's functioning, and then maybe, support that with another nutritional supplement and see if that becomes strong. Well, so he developed what's called applied kinesiology, muscle testing. And through another roundabout way, other doctors, other specialists have, over the years, refined these approaches to become what we use today here in the office called nutrition response testing. So using muscle testing and using all this information and technology and all this science over the last 100 years, we're able to use something now that can tap into exactly what your body needs in the moment, what nutritional deficiencies and toxicities are there, and be able to help you and support you the best way possible. And one thing that I learned about Joy is that she is getting away from the insurance model of healthcare. Dentistry is an incredibly expensive profession, and I'm sure, and that's full-on dentistry with dental hygiene. I'm sure it's much less expensive, but probably still pretty pricey. And so when you get into that, you're saddled with a lot of debt, a lot of unknown, and so going the insurance route may seem easy because it's like, oh, I can just fill this paperwork out and get some easy money. Well, as anybody who deals with insurance on the doctoring side knows, it's not that easy. They make you fight for every dollar now. And so getting away from insurance and becoming more independent and more wellness-based and holistic-based is a much better way to go. But the trouble is, when you do wellness activities, insurance doesn't really pay for that. Insurance won't buy your toothbrush for you. Insurance won't pay for your toothpaste. That kind of stuff is on you. And with what we do in our office with chiropractic, with nutrition response testing, it's nutrition, it's wellness. It's what you need to be basically healthy. And so, I know I didn't preface Joy with this, but I'm going to put her on the spot a little bit. I believe that she would agree with me that you don't need to brush your teeth. Just like you don't need to get chiropractic care to stay alive, you don't need to even eat organic to stay alive. When it comes to brushing your teeth, you only got to brush the ones you want to keep. That's the truth. So your health is only as good as the amount of wellness and prevention you want to give it. So when you listen to Joy tonight, keep that in mind. And if you need other help with your health, keep us in mind. You're here, we got information that you can take and learn more about what we do. You can check out our website and Facebook page and all the other stuff that we have. But I want to just give you that preface and that thought and that big picture idea that everything that goes on here, all the little things, mean a lot to the overall picture of you and your overall health. So now I want to bring up Leah. Leah's going to give a little more depth on Joy's background and kick her off. So thank you.
Good evening, everybody. I actually didn't do a lot of homework on Joy's background because she's just awesome and I just saw her last week. So I was actually going to talk to you guys about my personal connection with Joy and why she's here. So we have 5 kids, and going to the dentist in the last 8 to 10 years has not been my favorite thing. It has been, I feel like I'm telling my kids, like, don't say that we eat this or drink this, and they're like, why? And I'm like, because I don't want to get into an argument, but our insurance covered it, and so we went. And I will just tell you, we had this incident where my daughter ended up, I had no idea why, my 11-year-old was talking to the hygienist about how we had a Berkey with a fluoride filter on it, and she was talking about that, and then I came back to, and the hygienist said, well, why do you take the fluoride out of your water? And I was like, why are you talking to her about that? Because we do, and I just feel like it's healthy for my kids not to have fluoride. And she turns around and looks at me and she said, because you gave your kids fluoride for the first 5 years of their life, that was the best thing you could have done for them. And immediately I was like, I am in the wrong place. I need a new option. Because she's not hearing me, and I understand if we don't agree, but it was not right. And so I started Googling, didn't find a lot, and last year we were coming up on our appointments again, and I was like, I cannot go back in there. I can't. And so I started Googling, and guess who came up in my Google? And I called, and I was like, hey, what do you think about fluoride? And because I think I put natural hygienist, I'm not sure what I Googled, but Joy came up. We pulled all of our kids away, and they said, well, why are you leaving? And I said, I need someone who has a more holistic approach with dental care and with my kids. And they were like, they literally said, oh, and we hung up. And I was like, woo, we're done. So took my family to see Joy. My kids talked the entire ride home about what they learned. That has never happened, leaving the dentist. They were like, do you know Joy said when she got her big teeth out? I will say, Joy's very thorough. She's not fast, so you need to have time to go see Joy. Built into your day, totally worth it. You're gonna learn so much. So we were super excited to reach out to her and bring her here. So personal connection, I was just in last week and she told me I need to floss more, and I just wanted to tell you guys, because I tell people all the time with my nutrition response testing, take the next baby step. And do you know what? I've used a water pick 7 out of the last 9 days. And so that was my next
thing. You need to win the water.
I know, well, I bought one. So I have taken the next baby step in my dental health, and I'm confident you guys after tonight are going to want to do that too. So here's Joy.
Thank you, Leah. So I've been, I'll go back. I've been in dentistry. I've had my degree for 30 years, and about 7 years into it, I'm originally from Minneapolis, Minnesota, actually northern Minnesota, where it's really cold by the Canadian border. I knew there was more out there for me than dental hygiene, and if you would have told me I was going to come back to clinical, I would have said you're crazy. What I did is I left dental hygiene and I got into some companies, biotech companies. Some were pharmaceutical, which I learned a lot about pharmaceutical companies, but I also learned a lot. I specialized in the autoimmune area, bone marrow transplant, and the cancer arena. And I remember meeting with rheumatologists who are, the doctors of autoimmune, and they'd be telling me about, I'm like, tell me more about RA, rheumatoid arthritis, and why do they flare? And they flare because of stress, nutrition, other things. And I said, have you ever looked in their mouth, like if their gums are bleeding? And they'd look at me and be like, no, why would we do that? And it's funny, that was about 20 years ago. And so now you'll see studies done on autoimmune and bleeding gums or gum disease. Gum disease, periodontal disease. So we're now connecting the mouth to the body. And I can tell you, I worked for the first company that went out to dental offices to actually say the mouth is connected to the body, and here's what's happening with bacteria. I did not go into root canals tonight. That's a whole nother subject. But what I did get into was my leaky gums. Have you heard of the term leaky gums? Probably not, because I invented it. I'm going to claim it. That's going to be mine. I should get a website that says leaky gums. And the reason why I called it leaky gums is when I say, like Leah said, I take a lot of times with it. When you're new to me, I take a lot of time. When you start coming back, it goes faster, I promise. But that first time, I do take a lot of time with you so that you understand how your mouth has an effect on your body. On the first page here, I talked about periodontitis. And it's funny because when I was treating periodontal disease, does everybody know what periodontal disease is? No. So I'm gonna go back, gingivitis. Do we all know what gingivitis is? It's inflammation of the gum tissue. So what that means is the infection starts in your gums because of biofilm plaque not being removed most times, and it's a soft tissue infection. If you don't take care of the infection when it's in the gums, it will progress into the bone. And once it progresses in the bone, you lose bone support. It's the #1 reason why people lose their teeth. It is not from decay. It is from losing bone support. And it's all from chronic inflammation. So gingivitis is reversible, periodontitis is not reversible. Once you lose the bone that support your teeth, you're not gonna get that back. We don't have a way to get that back yet. I'm sure that will come. But what's important there is the leaky gums, the bleeding gums, okay? Because when your gums bleed, what's happening is it's opening up a window for that bacteria that's causing the bleeding. One particular is called P. gingivalis. Means nothing to you, but it's been in the news quite a bit with Alzheimer's disease. Have you heard the connection? Have you heard about a connection with mouth infection and Alzheimer's, or finding a link there? But it all correlates to opening up that window so the bacteria can get into the bloodstream. If your gums weren't bleeding, the bacteria wouldn't have a way into the bloodstream. But once your gums are bleeding even a little bit, we used to be like, well, your gums are bleeding a little. That's okay. We used to, because every patient that came in 20 years ago, their gums bled. Every patient had gingivitis and periodontal disease. Now I probably see it 1 patient a day that has no bleeding. So we're getting better. We're getting there. But I make sure the patients understand about, hey, when your gums bleed, it opens up the door for all the bad bacteria to get into your bloodstream. So with the Alzheimer's, I'll jump ahead here. With Alzheimer's, I'm gonna get into that since I brought it up. They did do some research, they did some autopsies on Alzheimer's patients, and they were not expected to find this, but what they found is the #1 bacteria in the brain of Alzheimer's was P. gingivalis, which is from bleeding gums. And they were shocked. And we don't know a lot if it triggers the disease, how much of an effect it has on the disease. We did find out they came out with a study 3 months ago, and if you're already diagnosed with cognitive, what would you call it? I'll say Alzheimer's. When you've been already diagnosed, that if your oral health is not good, meaning you have bleeding gums, you're gonna progress faster. And so I make sure with my patients that are caretakers, I have about 10 Alzheimer's patients in my practice, that they know this and they're on top of it. And it's a hard job to do because they're taking care of everything else too, but they do know they do progress faster. They decline quicker. I put on here the 5 stages of gum disease. I think we're poor at when you go into the dental office, it's pretty fast, like Leah was saying, I'm slow because I want you to understand this. It's important. Corporate dentistry is taking over. Has everyone heard of corporate dentistry? Okay, so, the mom and pop's dentistry is going away. You're starting to see it slowly shrink. They're saying by, I think 5 years from now, 80% of dental offices will be open by corporate. Why is that important? When I used to go into corporate dentistry, I was a consultant for a while, and I would go in, and this is what got me to come back to clinical. I was in an office, and it was corporate, so they owned about, it's a corporation, the dentist doesn't own it usually, the corporation does, and so the bottom line is revenue. It's not patient care. They care about patient care, but the bottom line is, what did we produce today? And I was in there, and on the whiteboard it said, we need 50 crowns this month. Yeah, and I took a picture of it and I can't find it. I can't find it to this day. And that is what made me decide to come back clinically and educate patients. And I'm bound to educate people on corporate dentistry and how to know if they're corporate dentistry. You already know Comfort Dental, Perfect Teeth, they're all corporate, but they're hiding their names. So now it's Fort Collins Family Dental, and I'm not saying they're the root of all evil, but I think you lose that personalized care, and you lose seeing the same provider. You never get the same one, which is unfortunate. So leaky gums, let's get into chronic inflammation. I want to talk about periodontal disease, where the infection gets into your bone. I was talking to the doctor a little bit about this. A lot of people I'd say 60% of adults have some form of periodontal disease, meaning their gums bleed and they've progressed to bone loss. And what do you do, right? Have you heard of deep cleanings? Deep cleaning, I hate that word. I would never go anywhere for anything deep. That scares me, deep cleaning. How about bacterial reduction therapy? Sounds a little bit better. So what we usually have to do is go underneath the gum tissue to get the tartar off so that the healing can start. What I started to notice was patients would come in, they would be doing their home care, they'd be flossing, using a water pick, they'd be using everything we told them to, and they continued to break down. And so we'd refer them to a periodontist, which is a gum specialist. And what would they want to do right away? Surgery. So because they're surgically inclined. And when I got out of clinical dental hygiene the first time, it was with this company that was promoting a therapy that treated the host response. And I thought, well, what's that? What's the host response? Well, it's how your body responds to the bacteria. And I would say there's about 10% of patients out there that have adult periodontitis that continue to break down. Their bone continues to disintegrate, I'd say, and they have chronic inflammation, bleeding, no matter what they do. And they're frustrated. They go in and they tell their provider, I'm doing all this, and we go, yeah, right. You're not doing that. And because your gums wouldn't bleed. Well, it is true. The hard part about it is we don't have a name for it yet. I call it autoimmune of the gum tissue because that's what it is. It's your body over responding to the bacteria in your mouth, and it's progressing quickly, despite all the care you can do. The only thing that I have right now to treat it, and I'd love to find more of a natural way to treat it, it's doxycycline. It's not an antibiotic level. It's 20 milligrams of doxycycline, where it suppresses the body's response, because the body's response is overreacting to the bacteria. And I can tell you that I've saved about 10 people's teeth from putting them on that for now. I want to find more of a natural way to do it. I haven't come up with that, and we haven't had enough studies, but the continued breakdown of that, they've been in tears coming to my office because they're like, all they told me to do is surgery, and I do surgery, and nobody believes me. And it's sad to see. And it's I call it autoimmune of the gum tissue, and that's what it is. So oral probiotics. You know what? I'll say, you know what? The first thing I do when you come to the clinic, the first thing I always do with patients is make sure that they're taking care of the biofilm. So what that means is using a Sonicare and probably water pick. How many of you use a water pick right now? It's an easy, natural way to use, I don't mind flossing if you're a good flosser. People hate flossing. Nobody is showing anybody how to floss. Like, I'll say to patients, do you like flossing or do you want a water pick? And they'll say flossing. I'll say, okay, Gwen's age. I'll sit them down and we'll say, okay, like with Leah's, we're going to show you how to floss. And they go, wow, nobody showed me that. They have no clue. We just tell you to go home and brush and floss. So I'm very thorough about that. I love the water pick. I can tell you, if you use a water pick every night and you don't have autoimmune of the gum tissue, you will save your teeth. That's how much difference I've seen in someone using a water pick. It really has a huge effect, along with ozone therapy, right? But a water pig gut, I don't know, it does a great job. I always say you're gonna hate it the first 2 weeks, and then after 2 weeks, you're gonna love it. And if you can get yourself into that habit, you will save your teeth. Let me go into, even at the University of Minnesota, that's where I did some of my schooling. We also looked at bleeding gums and diabetes, and they found that the AC1, am I saying that right? A1C, yeah, A1C levels, that if they were able to stop the bleeding gums and get better care, that it dropped a point or two, where it made a huge difference on a lot of those diabetic patients. So, it's related to stroke. Why is that? Heart attack, it's like 3 times more likely to have a heart attack or a stroke if your gums bleed. And the reason why is all that bacteria gets into your bloodstream. So your body responds with an anti-inflammatory response. So your arteries, instead of being like this, are now like this. So you're more apt to have an event. Questions about that? No. One of the things I measure is the C-reactive proteins. Does everybody know what that is here? Do you guys measure that here at all? The C-reactive? It's the inflammation that you have in your body. Usually if we measure it at the beginning of care, if we're taking some care of someone who has periodontal disease, what we'll do is measure it, and at the end of treatment, it's usually fallen quite a bit. It's amazing. But C-reactive protein is the inflammation that you have in your body. The inflammation count. The oral microbiome. I don't think it's surprising that if your gums are bleeding, you have inflammation in your mouth, that you're swallowing all that bacteria into your gut. So imagine what it's doing to your gut. How many here have gut problems? Yeah. Imagine all that bacteria that you're swallowing, and it's going right into your gut, and it's just adding to it. When I was reading up on this, refreshing my memory, the gut has most of the bacteria. The second is the mouth, which is the gateway to the gut. So all the digestion starts here, and it goes to here. So no wonder why, people that have stomach problems, I always say, have you been to the dentist lately? And a lot of them don't even think of it, because let's face it, bleeding gums doesn't really hurt. You might see it. They'll say they bleed a little, but it doesn't hurt. Otherwise, people would be running to go in. Here's another big one that I want to talk about. pH of the oral cavity. Okay, has anyone heard about the pH and how it can cause? Yeah, this is kind of new to dentistry. We all should be testing pH. Really, the best time to get your oral pH is in the morning before you've had anything to eat or drink. So the reason why this has become an epidemic, surprise, surprise, we're calling it mask mouth because of masks. So when you wear a mask, next time, hopefully you never have to wear one again. We've always worn masks, so it's kind of funny when people come in, they go, "You don't have to wear your mask for me," and I'm like, no, we always wear it because we're right in your face. But next time, if you have it, God forbid you have a mask on again, kind of be aware of how you're breathing. So most of the kids, I've had 5 families in this month that will come in and say, "I want a second opinion. Why is my daughter getting cavities all of a sudden? She's my best brusher. Why is she getting cavities?" And I'll sit them down and I'll say, "Well, when did it start?" And they'll say, "A couple years ago, about 1.5 years ago." I said, "What do you think's changed?" And they'll say, "Nothing really has changed." And I'll say, "Are they wearing a mask at school?" And they'll say, "Yes." And I'll say, "What's happening is they're drying out their mouth by mouth breathing. And when you're dry, you're acidic. And when you're acidic, the bacteria that causes cavities, 300% higher. And also the gum disease too. The bacteria that cause it. So we're gonna see an epidemic here in cavities. I can already see it in kids and in adults too. So when I first started in dental hygiene, I knew it wasn't just oral hygiene care. It was more than that. We'd have families come in with 5 kids. It's always the best brusher that has all the cavities. That Johnny is the best brusher, why does he have all the cavities? And back then we didn't know. And I remember the dentist saying, well, that's because he has the bug. He has the bacteria. S. mutans is what's responsible for cavities. But he has the bug. And I thought, well, that sounds good, that's what I'm gonna say. He has the bacteria. Well, what does that mean? And that was good enough. People would say, okay, and they wouldn't ask more questions. I knew we didn't know. And now today I look back, and it's from mouth breathing. You know, patients that are breathing, when you go talk about Dr. Price, when he did his studies, we're starting to see wisdom teeth now go away. And it's because of diet, because we're not using those teeth anymore. So things are collapsing, and so we're starting to mouth breathe more. And when you mouth breathe, you're more acidic, and when you're more acidic, what happens? Bacteria triples, just like the body, bad things happen. So now you're starting to see, and this was my last thing I kind of was going to talk about is myofunctional therapy, oral myofunctional therapy. Have you all heard about that? I was going to touch on that a little. That's a huge new, I'd say, therapy that has come to light in the last 5 years. It's where we work with kids and adults on breathing. You know, especially kids that had tongue tie, lip tie. The tongue ties that I see in adults is astonishing. When they come in, I'll say, they can barely move their tongue, and I'll say, your tongue's tied. What? What do you mean? I'll say, where's your tongue when you're resting your mouth? When you're closing your mouth, your tongue should be, the tip of your tongue should be right behind your 2 front teeth. And the reason why that's important is because when your upper jaw, your maxilla is developing, it helps widen it out so that the air and the breathing is open as you grow. If it's not, if your tongue, because your tongue actually helps that, so if your tongue's sitting on the bottom, you're not gonna get that. And the child's gonna have an underdeveloped palate unless they get some care. There's a, you know, it's expanding the maxilla. Ortho's been doing it forever. There's some new companies out there that just focus on that, appliances and myofunctional therapy. And we work with the muscles and different things in the mouth to develop muscles that weren't developed. Some of you have heard of it? Or has anyone been through it? I'm in training right now to get certified.
Can I ask you a question?
Yeah.
Does it have to do with tongue exercises?
Yeah.
Like pushing the tongue
Yeah.
up, not aggressively, but I mean, I heard someone talking about that for even sculpting of the face.
Yep.
Like when you have sagging jowls, you
Yep.
can actually need
Yep. The
toning of
muscles.
and
So when you're tongue tied too, you know, you come in and we notice that you're tongue tied, you're using muscles and you're not using muscles that you should be. So a lot of times you'll see an oral functional therapist to develop muscles before they release the tongue and then after.
Do you have someone you work with, or do you do that service?
Yep, that's what I'm getting certified in right now.
Cool.
You're seeing more and more people in Denver. There's a lot of oral functional therapists, myofunctional, but you're gonna see it grow. Some speech pathologists or specialists have it too, I noticed. But a lot of times, like a dental hygienist, you're gonna see more and more of them get into that because it's a specialty area for us, and working with the orthodontist. Yeah, I have a dentist coming in to partner with me, and I'm hoping that that's one of the interests, so I can oversee kind of that program. Yeah, so, yeah, it's an up and coming kind of profession, and which is helping a lot of people. So I jumped ahead there, you guys. I put a lot of notes in here. You can read through it. There's a lot of good stuff. One of the things I wanted to mention about the oral microbiome, you can actually, there's a company that you can actually give them your saliva, and they'll give you a readout of your own bacteria that you have in your mouth. I use a different company when I'm dealing with periodontal disease, but I can actually have you spit in a little vial. I'll send it off and they'll tell me what bacteria that I'm dealing with, but they always, I don't like to use them all the time because their only solution is antibiotics, and I don't like giving the antibiotics unless I absolutely have to. So there's different companies, but the one I had in here it was Bio. It's kind of cool because you come back with your, let's see. I just had it in here, I thought. I want you to make sure you have it. I think they charge about $150. Do you guys do that here at all? Saliva testing or anything like that? It's in here. Now I forget where I put it, but look for it. If you can't find it, you can always.
Bristle Hill?
Yes, there you go. Bristle
It's
Health.
on the left.
Yeah,
Yeah.
yeah, Bristle Health. So you can actually, they'll give you your own reading on bacteria, and it may help you with probiotics. I mean, do you use probiotics quite a bit here? Yeah. So, one of the things with oral probiotics is, in some of the research is to help the oral cavity with you have the bad bacteria and the good bacteria. A lot of these mouth rinses, I actually used to work for Listerine. Great product, but it'll kill the good and the bad. You don't want to kill the good, okay? So people say, I have bad breath, I'm gonna use Listerine, it's gonna kill it all. Even better yet, the gold Listerine, right? Whose parents all use that we can smell about a mile away, right? That'll kill everything. You won't have anything left after that. But, the probiotics are helpful for something like bad breath. But you need something like a lozenge. You need something that's gonna stay in the oral cavity. It helps the gut more when you swallow it. One of the things we started to see a trend on too is I don't want people to do this. We were like, oh yeah, use kombucha. Did I say that right? Kombucha, the drink. Go get that. It'll help. It's good for your stomach. It's good for the bacteria. Well, all of a sudden we started seeing cavities everywhere because there's sugar in that and it's acidic. Love it, but don't drink it every day. And here's an example of sugar and acidity. I had a kid in, a month ago. He called on a Sunday and was in pain, and his mom was an MD, and he grew up in Colorado Springs, and he was going to school here. And he said, we go to the dentist every 6 months. I just have missed the last year and a half because I'm in college. And I thought, well, good. And he's like, I've never had a cavity. And I was talking to him on the phone. He was in pain. I said, okay, why don't you come in? They always wait till Sunday to call, right? They've been in pain for 2 weeks, but wait till Sunday. And the most expensive day to go in for an emergency. And so he comes in, and I'm taking some films, and I look at him, and I'm like, this kid has 40 cavities. 40. Okay, one of the worst I've ever seen in my career. You know what he was drinking? Coke and Mountain Dew. All it takes is 2 a day, and you will look like that. And I was talking to his mom on the phone. I think she thought I didn't know what I was talking about. Like she was hoping, I think, like, well, you're not a doctor, and I'm like, you're right, but, and sure enough, 40 cavities. Every tooth had a cavity. And I looked at him and I said, and usually it's Mountain Dew. I don't know what it is about Mountain Dew. I think it has more sugar and it's more acidic. And he said, yeah, I do, We used to see it in the 80s more, late 80s, 90s when it first came out, Mountain Dew, but that is the worst thing you can do for your teeth.
Is the
Worst.
flame retardant in it?
Yeah, probably. Well, Coke, what do they say? You see those things that they use for Coke and Mountain Dew are the worst. Mountain Dew's worse than Coke, believe it or not. I had to tell that story because I hadn't seen that in years. Yeah, and vaping, he was vaping. I think vaping has something to do with it too, you guys. I think it's up and coming, we're gonna see more. Questions, they want me to cut it to a half hour, so I think I put a lot in here. I wanted to touch on the basis of my specialty, what I see. I don't do root canals. I've read up on it. I know all the research. I know the talks about it. It's a whole that's a whole hour kind of discussion on that. But the bottom line too with root canals, it's, I don't want to say the wrong thing either, but root canals, what I find is when they fail, it doesn't hurt when they have it, when it's reinfected. If somebody has a root canal and they come in to see me, I'm not usually like, you have to get that out right away. Like, now I think everyone is individualized, but when someone comes in, I always take a picture of it because 9 times out of 10, I'm gonna find infection. that they can't feel because the tooth is dead. So this infection is going on and they can't feel it, and you show it to them and they're like, and they still don't believe you because it doesn't hurt, and you see this round dark spot, around it, and you say this is reinfected, and usually when they get reinfected, that's the time to take them out, and do an implant. So that's, that's a whole nother discussion though, but that's kind of what I see a lot is reinfection in them, and they don't know they have it. And so they're walking around with this infection, and it's wreaking havoc in their system because it's getting into their blood. I had a kid in last week whose dad died from one. The bacteria went to his heart, and he actually died from it.
I was gonna say, isn't that the biggest link, is
Yeah.
the root canal infection to heart problems?
No, it's actually bleeding gums. Bleeding gums,
to heart
gingivitis,
problems?
yeah. I'd say it's about equal, but bleeding gum is more prevalent.
But, I mean, is there another top thing that a root canal affects than the heart?
It can, yes. It'll affect the heart because of the infection, the inflammation.
Right, is there any other organ system it affects worse? I guess
The
I'm just saying,
heart,
I see
well,
that-
the
I hear
heart,
that
you're more
correlation.
likely to have a stroke, heart attack because of the infection, chronic infection. Yep. But the heart is the big one for root canals and infection and tooth infection. Where bleeding gums is more of a chronic thing that it's infected. It's not deeply infected yet, where root canal is a deep infection, where it's a lot of bad things going on. Where gingivitis, gum bleeding, and then it gets into the bone, that's when it gets bad. Anything in the bone.
Now, when you talk about gum bleeding, are you saying bleeding every day of the week, or bleeding only after flossing, or both, or yes?
Anytime. Your
only
gums should
both?
never bleed, ever. You might get something caught in your gums, like a popcorn kernel, it's gonna bleed, but it goes away after you floss it. A lot of people will tell me this, when my gums bleed, I stop flossing, or I stay away from there because I know it's bleeding, I don't wanna irritate it. You should do the opposite. You should be attacking it. And so, back in the day, we'd be happy if we saw just a little bit of bleeding. Now today, with what we know, it should be no bleeding. And that's why I'm so big on the water picks. Yeah. And I have a patient here today that uses ozone every day, who actually got me into ozone. And she has a unit herself that she uses at home every night and every morning. She has the best gum tissue that she has no bleeding. And it's rare for me to see that. And she uses a water pick too, right? Am I missing anything else? Electric toothbrush, yeah.
Vitamin C.
Huh?
And vitamin C.
And vitamin C. Yep, and I just ordered mine today. Yes, vitamin C and vitamin D, vitamin C and vitamin K2 is for the oral health. If you look into those and why they're good for the oral health. The K2 I keep brushing up on, but it helps the vitamin D. You would know more about that than I do because you guys are the vitamin experts, right? Yes.
Question about little kids. So I've been hearing more and more over the years about children who still have their baby teeth having massive dental issues and having pretty extensive work done that you would mostly see in adults, because usually we just be like, oh, it's a baby tooth, let it fall out and it'll grow back in. So what
With
are
the
you seeing along
decay?
those lines, and what do you recommend for those kind of families?
With the decay, you
Yeah.
mean when they have so much decay? There's two things going on with that, I think, is the pH. They're breathing through their mouth, a lot of them, with the decay. And another thing I'm seeing an epidemic of is lip tie for the baby, and when moms breastfeed, so we're breastfeeding more, and what's happening is these kids are holding their milk right here under their lip, and breast milk still has sugar in it. And I'm seeing an epidemic of, all of us are, of decay on these front teeth. And it doesn't take much. You have to remember, kids' teeth is 3 times as thin enamel than adults. So once they get a cavity, it goes really fast. And they're holding this milk right here. And I don't want to say breastfeeding's bad, because it's not. It's just that when a kid gets a tooth, I think right away we're not cleaning it. We're not. And I tell my patients to just even wipe the first tooth, even if they have one tooth, wipe it with xylitol. Xylitol helps keep the pH balance, and keep the bacteria away. But, I think that in addition to mouth breathing, because of our collapsing jaw from the Western price diet, you know, our diets are changing, we're collapsing, and we're not getting wisdom teeth, so we're collapsing even more. And I think mouth breathing and not taking care of the teeth early is what's causing a lot of that decay. And also, you know, people, you gotta keep in mind, it's not just candy and sugar that cause cavities. Carbohydrates are the worst. Anything that sticks to your teeth, it's worse than candy. Crackers is what I'm seeing, and parents are shocked when I tell them that. You know, anything that sticks to your teeth, carbohydrates is gonna turn into sugar.
Is there a good toothpaste you recommend that helps balance pH? Is that
So,
in here? We didn't
yeah,
look at it?
you know,
Okay.
I have a rinse that I go to, Nutrisol. It's all natural. It's a super saturated calcium phosphate rinse. I know a lot about it because I worked for the company for a while, and it's the only natural rinse that actually changes the pH that it has been studied. There's a lot out there with pH rinses, but they can just throw it out there and say that, and they don't have to prove it, so thank you for saying that. Another big thing today is hydroxyapatite in toothpaste. And I put that at the very end. I talk about that. Fluoride versus hydroxyapatite. Hydroxyapatite in Japan, that's what they use in their toothpaste instead of fluoride. And hydroxyapatite has been known to actually reverse decay in some cases. It hardens the enamel. 90% of our enamel is made up of hydroxyapatite. It's a mineral in our enamel. And by using, when I was researching it, the nano hydroxyapatite, there's two companies that make hydroxyapatite in their toothpaste. It's Boca and Risewell.
Is that what you recommend?
Yeah.
Boca and
Yeah.
Risewell?
Yeah. So toothpaste, Leah, wise, not so much pH, but the rinse. I'm really into that rinse. And anybody that gets sores in their mouth, that pH rinse is big. It is a prescription right now, it shouldn't be, it's all natural. So I'm waiting for the day that we can carry it in the office, because it's big.
And Joy, do we carry a toothpaste and a rinse? I would love to know your opinion. We use it because there's liquid gotu-kola in there and the herbal, support for the connective
Yep.
tissue and
Yep.
the dental, not just the teeth, but obviously the
Yep.
gums. We've used it for 12 years
Yep.
from another holistic minded
Yep,
dentist, but we are also firm believers that decades go by and we have new genetically modified bugs and we have new
Yep.
poisons and we have new toxins, and so,
if you need additional support, toothpaste matter. If you know, I'm a firm believer that if you're brushing, flossing, using a water pick, toothpaste doesn't really matter. It's getting the biofilm off. If you have decay problems, then that's when, and it's all individualized, you know. That could be for somebody who has
Right.
not one fits all. The hydroxyapatite is geared more towards cavities,
Oh,
where that would be helpful for the gum tissue and the connective tissue, and I'm all for it. Yeah. There's so many different ones out there, you know, like glycerin. I have some patients that are concerned about glycerin in toothpaste too. And you were telling me that. What was your concern with that? I wanted to learn more about that. The glycerin.
Me?
Yes.
I read in, and I can't remember the name of the book or the author, but he had a child that had all of a sudden had all sorts of dental issues with baby teeth. And he went along with the Weston Price and did cod liver oil,
Yeah.
sharp oil,
Yeah.
and he was the one that said glycerin interferes with the minerals getting back into your teeth.
Interesting. And I need to learn more about that. And she always challenges me. She comes in and challenges me, and I love it. So I learn more. So I need to look into that. Yeah. Thank you. Yep.
Comment, not necessarily a question, I'll ask for the kickbacks later. When I first started, or years ago, as far as with my dentist or whatever, the fact that my gum numbers were starting to get elevated and stuff like that.
You mean the probing?
Yeah,
Yeah.
and it's like,
The poking.
okay, you need to start flossing more, everything else.
Yeah.
And then I started coming here, I went back and they're like, oh, you're doing a great job flossing. And I'm like, even though I still have flaws. And they're like, but your numbers are so much better.
That's awesome.
And then talking to my acupuncturist, he's like going, yeah, it's like your gums are one of the first things that sees the body inflammation.
Yep.
So you're addressing the body
Yep.
inflammation. So it's, I mean,
Yep.
you're talking only from address the mouth, but
Yep.
then there's the
Yep.
opposite. And I said something to my dentist and the dental hygienist, and they're like, what are you talking
We wouldn't
about?
believe you.
And it's
Yeah.
like, yeah, they just kind of thought I was crazy or whatever. It's like,
No, I believe that.
so-
Yeah. Whole body. You know, in dogs, what do the veterinarians do when they look at the health of a dog? Yeah, gums. That's the first thing. Yeah, no different, I don't think, in humans, you know. And I do think, you know, inflammatory coming from another area, it can show up here, vice versa. Absolutely. And your diet gets better. You know, think about what you were eating before and after, nutrition-wise, right?
Well, like,
Eating before and
Yeah.
after.
Right?
do, roughly.
Was your nutrition better now because
yeah.
you saw the nutrition specialist?
And it's funny because it's like, because he still was going down to Houston, wherever the acupuncturist,
Yeah.
and one time he's like going, and we've talked about this a week or two before as far as just with the body inflammation and
Yep.
stuff. And he's like, God, my gums are bothering me, kind of like feel like almost there's something stuck. And he's like, oh shit, I had cake. And it's like, he's like, goddamn, can't do it. Because we've been talking about that
Yep.
body inflammation
Yep.
with the teeth and the numbers and
Yep.
stuff. So.
Acid too, you know, a lot of acid, and that's good to hear. I love hearing that, you know, that hey, I wasn't even flossing, but my tissue got better, because your body, you know, the fastest tissue that heals in your body is your mouth and your eyes. Yeah, doesn't take long to get this healthy. It just takes focus, you know, and nutrition is a big part of it too. And I didn't talk about that as much because I leave that up to the nutrition specialists, right? They probably know more than I do when it comes to that. But, you know, I know a little bit about the decay, and I'd say my specialty is the gums, you know.
What's your thoughts of periodontics?
Periodontal disease?
No, periodontics.
Toothpaste.
Periodontics, I don't know about it. I may have heard of it. There's so many, you guys. There's so many different toothpastes that have come to the market. And like I say, you know, look at the ingredients. If you like it and it makes your mouth feel fresh and good and things are good, then keep using it.
That one did stop the bleeding. the
Uh-huh.
probiotics.
Okay, yep,
That's what my dentist gave me.
yep, and it could, you know, and I think too, we start to brush better a little bit, you know, when we use something we like.
And I did start using water picks.
See, it's that water pick. That water pick will save your teeth. Yes, I'm a firm believer. People that use a water pick every night come in with no bleeding. Yeah, and the decay is way down too. It's just hard for kids. It's hard to maneuver for kids, so.
How do we feel about tongue scraping?
You know, if somebody, you know, I don't want to get rid of the good bacteria too. I'm not against tongue scraping. You know, if people feel that their breath is bad, or they're being told it's bad, it's a good place to start. In fact, the water pick now has an attachment for the tongue. Another reason to get a water pick. In fact, we're gonna give away a water pick too, right?
Yes.
Do we have a drawing?
What about oil pulling?
I like oil pulling. At first I was very skeptical, and then patients came in. There's an ozone oil pulling product that I really like. They say sesame oil is better than coconut oil. I like coconut oil. I've seen results with it. People that rinse with it, especially at night, I've seen results where their gum tissue looks healthier. I don't know quite what's happening yet. I think it's because the biofilm can't attach to the tooth because it's slippery. I think that's kind of part of it that's happening. Anything that though is helping the health of the oral health, I'm for. Yeah.
Can that be overdone?
Oil pulling maybe not so much, but you could certainly like brush too much and water pick too much, you know. And you gotta water pick the right way. You can do damage with the water pick. You know, if you're, you know, when next time you're in the dental office, ask them how to use it. You know, and they'll look at you like, really? You want me to show you? I show everybody because you can ruin your gums with it. Because it's very powerful. Yeah. Go on YouTube too, they'll show you on the, yeah. There are more companies that are making it. Waterpick is actually, the company is in Fort Collins. Yeah.
Do you agree with going to the highest pressure you can, or just leave
Yes.
it down a low?
Nope, highest. Start low, get your gums used to it, it stings, right? And then it gets better. Yeah, I've seen people that stay on like a 6 and not to a 10, and they still have biofilm and plaque. So it does make a difference. I'll ask them, they'll say, I'm using it every night. And you're like, uh-huh. And then I ask them, what level do you have it at? And that's usually what it is. Yeah, yeah. Because that biofilm is pretty, it sticks, you know, it's hard to get off. You know, you gotta think the biofilm is soft, that's what we're trying to get off. That hardens in 3 days if you miss an area, and that's why you come in and see someone like me to take off the tartar, because you're not gonna get it off. And when it turns hard, it's like having a sliver in your hand and letting the sliver sit there for 6 months. That's why your gums bleed from it. People who use a water pick tend to had very minimal tartar, hard tartar, you know, because you're getting it off when it's soft. But yeah, that's,
I love your relationship between what's going on in the gut could be because proper stuff is not happening in
yeah.
the mouth, and at the same time, I hear what you know, I mean,
Yeah.
well, we've talked for years
Mhm.
over, people having less bleeding, less plaquing,
yep.
less dental problems because of I mean, we are connected from the tip
Oh,
of our
for
toes
sure.
to the tip of our toes.
For
you
sure.
know, so.
Yeah, diet has a lot to do with inflammation in the mouth, and eating the right foods is huge.
Huge,
Bigger than what we ever thought. Yeah,
or are allowed to believe.
yeah. And there's so much more that I'm missing, you guys, I could talk forever. But, you know, these are just kind of the big things that I touch on. And I test the saliva pH, every new patient that comes in. And when they're acidic, usually I find that they're having some problems. When they're alkaline, usually nothing. So it's pretty on.
I've heard that water is also acidic, bottled water.
Yeah, have you started to see water has pH on it now? Have you guys
Yeah.
seen that in the stores? Like, I'm gonna get one of the glass, I was telling, Shayna, is it Shayna? No. Shanna, that I wanted to get a glass, water in my practice that has the pH, the alkaline. But you're right, you know, in people that drink water all day, it actually can affect the pH and the biome. Yeah, where it over, saturates it, cause it gets rid of the good. So they're saying, you know, don't sip on it all day. I know, yes. But you'll notice now, it has, you'll go into the store now and it'll have pH, and it'll say, you know, the normal pH of saliva should be 6.7 to 7.4. 7.2. That's a normal pH. So if it's lower than 6.7, that's when the bacteria triples in your mouth, starts to triple. Yeah, because the bacteria can't survive in the alkaline. Yeah.
Joy, would you tell us about your offer? Do you have an offer at your, I don't wanna speak out of turn, but is there anything that you want to invite people to do at your clinic, or?
Yeah, you know, and I still, if you have insurance, you know, I'm getting away from it. I will still submit it for you. But what I do is if you don't have insurance, I'll take 25% off of your first visit. And, I'm always willing to work with people. You know, I'm always about oral health, and, you know, I've even had people come in and I'll, let them do 2 payments, you know, it's, people, I don't want you to stay away. The longer you stay away, the worse it gets. When something starts to hurt, it's big. So, you know, the problem is when it doesn't hurt, they don't come in. When they come in, when something's bothering them, it's pretty big. I'd rather you come in and find out when it's small so we can fix it. But I'll work with you too, but any new patient, 25% off your first visit, for sure. And not everybody's the same. I see some patients every 2 months. I see some patients once a year, because they don't need to see me more. I'm not a cookie cutter every 6 months. A lot of people fall into that, but a lot of people fall out of that too. You know, some people it's rare, but once every 1.5 to 2 years, because they do such a good job and they maintain. And then, I take a long time for your first appointment because I'm very thorough on what's going on, and then after that, you know, we get better, but I'm not one, most clinics you go in, they get 50 minutes and that's it. and you're not gonna hear this stuff. They're stressed, they're seeing 10 patients a day, and they don't have time. You know, they miss lunch, and they'd love more time to educate you, but they don't get it because of revenue, so.
Got a question. How do you handle patients with TMJ?
Oh, that's a tough one around here. You know, when I was at the University of Minnesota, we had so many specialists with TMJ. You know, we start with, first try to find you a TMJ specialist. I think that's important. But have you heard of occlusal guards? You know, I think a lot of it's stress. We saw a lot of TMJ when the pandemic hit. People were clenching and grinding like crazy. And, you know, you pop in a occlusal guard, you know, and relax those muscles at night, and that seems to do the trick. And also exercises. That's where the oral or myofunctional therapy comes in. Yep. I had a guy in last week, and I was doing a TMJ. I was checking his TMJ, and he goes, "Oh, that feels so good." Like, I'm not gonna sit and massage you, buddy, but I know that feels good. But, you know, we're all like tight right here because of stress. But usually those occlusal guards, popping those in at night, usually work pretty good to release that tension on your. But TMJs are tricky. You know, I always tell people not to do surgery. Don't ever do surgery unless you absolutely have to. Because TMJ, that doesn't mean that it's gonna fix it. Sometimes it's worse. It's a tricky joint to treat. And you gotta know what you're doing and specialize in it.
I have to do a shameless plug.
Yeah.
So chiropractic adjustments in the upper neck area.
There you go,
are
yeah,
very
there you go.
powerful
Yeah.
for everything in the head and face. We
Yes.
see that with little kids and ear
Yes.
infections. It's all in the same region.
Yes.
So I actually have a lady right now. She was gone for a while. She came back after several months off, and she's talking about
Yep.
TMJ issues.
Yep.
Well, I'm not working on the jaw directly, but I'm
Yep.
adjusting the upper neck. And she's saying that she's noticing that tension and
Yep.
pain start to reduce.
Yep. So chiropractic, right there. And have you noticed with the epidemic that more people are suffering from it?
Oh, just stress
Yeah.
through the roof.
Yeah.
And so calming down
Pulling
the
on
nervous
their
system.
ears.
Yeah.
Yeah.
Their
I mean, I
masks
couldn't
all
believe
over
it.
their ear.
Yeah, I mean, almost, I was like, wow, this is like every other patient.
Yeah.
And then I'm like, what's going on here? And then I started talking to colleagues and they said the same thing.
Yeah.
Yeah.
And I'm hearing that kids, because of having to wear masks, they're coming in, they're finding more speech impediments.
Oh, yeah. Yep, for sure. And mouth breathing like crazy. Yep, so.
All right, well, let's
Thank
give
you.
Joy a round of applause. Yes,
Yes.
like our chiropractor.
I
right
know,
here.
yes, and that is probably the best person you can see for a TMJ.
Yes, yes. So we're gonna do the drawing here in a minute. We're giving away a water pick, and we're also giving away a bottle of our tonic. So at Inside Health, we love collaborating with other natural health practitioners. And for those of you who know my story, I had Lyme disease. I was super sick, and I went the traditional medical route. Actually, I'm in the Lyme disease world of antibiotics, but then after that, I went 100% holistic and trying to have those connections to know where am I going, where am I referring people I love, how am I telling them there's others options out there that they don't know about is huge. So we are very thankful to have Joy here to be able to refer to. We want to have our own underground network of holistic practitioners so that we can take care of each other and our friends and our family to be able to refer back and forth. So Joy gave her offer tonight. We always like to have an offer when we come and have our lectures. So if you're not a current nutrition response testing patient here at Inside Health or chiropractic, our offer it's normally $300 to come in for a new patient exam. And we offer that tonight into tomorrow at noon. That will expire for $39. And that is for you or someone you love if that's something you are interested in. So we would love to, Shanna's got a sign up out back there. If you would like to take us up on that. We also, Kristen and Katie and Dr. Lauren back there, wave your hands. Kristen and Katie are the other nutrition response practitioners along with myself and Dr. Lauren. Dr. David hangs out with all of us. And so if you are interested in doing a complimentary 5-minute NRT nutrition response testing screening. We'd be happy to take you back. We're going to do that for you tonight. So again, if you'd like to get on the schedule with you or a loved one by noon tomorrow is when that $39 offer does expire. So, are we ready? Are you doing the drawing?
Yeah.
All right, drum roll. All right, what are we drawing for first? The water pick or the tooth
Sure.
tonic?
Tooth tonic.
Tooth tonic is first. All right, go ahead.
I do love that stuff.
You
Yeah.
know, you've seen that one. I
Yeah.
wonder,
I do like it. Yeah, for when I'm treating periodontal issues.
Got it, okay, great.
Do you like putting that in the,
Yeah.
okay.
The water pick.
In the
Yeah.
water pick?
Yeah, but you gotta make
Too bad
sure
you
you're
can't
putting
bring
the
both.
right one in there, because
Right.
it can ruin it.
Oh.
You gotta use it for the oral irrigator, they have a special
Is
one
this-
for that.
Got it?
Yeah, so make sure you read it.
Maurice. Yes. All right, she gets the tooth tonic.
Have you used that before? No?
Okay, and now the water pick, which is not here, by the way, right? They're
No,
gonna-
I will,
she'll get it to you.
yes. I will give you my card with my number on here.
Jessie!
Wait, what was that? Well, she knows how to get a hold of me. It's funny, she had come to see me last week and I go, oh, you must have heard about me, I'm coming to your sister's clinic. She's like, no, I didn't know that. And I'm like, really? How'd you find me? And she's like, no, I just looked it up, so isn't that funny?
Yeah.
Law of attraction,
We
right?
basically did the
Seriously,
same
yes.
thing
Yeah.
around the same time.
Yeah.
You know, like I need to find
It's so
somebody.
cool.
Yeah.
Different option. Well, thank you all for coming. Feel free to hang around. If you'd like that complimentary screening, we're happy to do that. Otherwise, are you able to hang around for a few minutes too?
Yeah, I can hang around for a few minutes. I just
Okay.
have to pick up my daughter.
Awesome. Thanks, guys.